My name is Tim Harmon. I'm a registered nurse and I work in Newcastle Pharmacotherapy for DACS. So I've been a registered nurse for Hunter New England Health for about 4 years, but I've very recently moved over to drug and alcohol clinical services within the last sort of 3 months. I'm a mental health nurse by trade, so formerly a mental health nurse within the Hunter New England Health area. I feel that there were a lot of transferable skills from mental health nursing into drug and alcohol nursing. I like working with marginalised communities, disadvantaged people. There's a lot of stigma associated with drug and alcohol, and a lot of people that have alcohol and other drug misuse. I like working with a lot of those consumers. I like that drug and alcohol nursing is quite holistic. We're looking at physical health of people, mental health, which is my background, and also the substance use issues as well. There's a lot of psychosocial issues too that we're dealing with. So I feel like when we're assessing patients, when we're managing patients on our program, I find that a lot of my background lends itself to this type of nursing, and really feel like I can make a big difference. I think the benefits of those multidisciplinary teams are that you're getting lots of different perspectives, lots of different skill sets that bring a lot to the table for every single consumer every single time. So I really like getting perspective from the nursing staff that have that day-to-day interaction and rapport and relationship with our consumers. We've got doctors, pharmacy and allied health that really kind of contribute in getting good outcomes for our patients. It can be really varying. There's lots of kind of different roles in what we do as drug and alcohol nurses. It can be from dosing people on maintenance pharmacotherapy to doing assessments, triaging the various issues that come in, working with people in various aspects of their life and trying to get good outcomes for them. I'm solely based here in Hunter Street in Newcastle, but certainly there are other roles within the service that if anyone's interested in, they could look at that are a bit more community-based, out and about. I would say that looking at the team that I work with, and as I said, really complements each other. We have people from all different nursing backgrounds, from the hospital setting to mental health to community-based nursing. And I think that kind of those varying backgrounds really complement each other when supporting our patients and looking at things from all different angles and perspectives. Outside the normal kind of learning and development things, there are a lot of online stuff. I've been here a short time, but I've already seen some of my colleagues go away to some really great conferences and things outside of the Newcastle area. So I'm looking forward to maybe putting my hand up for some of those in the future. I'm quite a new starter, as I say, within the last 3 months. And there's staff that have, anywhere from sort of 5 to 20 years experience in this particular service. I find it really, really supportive and cohesive group. Really helpful for me as a new starter. I felt very supported. I've always had an interest in drug and alcohol nursing. I think the pathways to mental health nursing were much easier. There were significant number of new graduate positions when I finished uni, and not so many drug and alcohol positions. I'd managed to score some drug and alcohol placements at university, which really kind of got my interest started, and then saw a position come up, applied. But I've always had that kind of interest in the field. A lot of crossover from mental health nursing, a lot of quite similar consumers, and a lot of people that are quite stigmatized who I really feel a great passion for supporting.